Welcome everyone, and thank you for joining our webinar today with Global Health 101 author Richard Skolnik. Richard will be discussing his new bonus chapter today, Intersectoral Approaches to Enabling Better Health, which just published last week and is now included as a supplement with Global Health 101. I realize it's a busy time for faculty with finals happening and everyone trying to wrap up the semester before the holiday break, so I'm really pleased you're able to spare some time to join us today. And I hope this session will help you make the most of this new material and your teaching this approach in the spring semester. My name is Sophie Teague, and I'm the Senior Marketing Manager for Public Health and Health Administration here at Jones & Bartlett Learning. And if you're not familiar with Jones & Bartlett, we are a provider of instructional, assessment, and learning performance resources for the secondary, post-secondary, and professional markets, and we specialize in the areas of health and safety. Before I introduce you to our presenter, Richard Skolnik, let me touch on just a couple of quick housekeeping items. First off, the formal part of the presentation will last about 20 minutes, and following that, you'll have a chance to ask questions. If you want to ask a question, simply type it into the questions box, which is on the lower right-hand side of your screen. And after the presentation, I will read your questions aloud. And of course, you can type your question in at any time during the course of the presentation. So if you think of something in the middle of the presentation, don't hesitate to go ahead and type it into the question box, and I'll read it once we get to that to the live Q&A session. We won't be taking any questions out loud today, only via the question box. The slides are also available to everyone as a handout. If you look at the handout section on the right side of your screen, there's a button there that you can go ahead and download the slides. They will also be included as a link in the follow-up email, which will come along about an hour after the conclusion of the webinar. Also, the entire session is being recorded, and a link to the recording will also be included in the follow-up email. So at this point, let me introduce you to our featured presenter, Richard Skolnik. Richard Skolnik was most recently a lecturer at the Yale College, the Yale School of Public Health, and the Yale School of Management, where he taught introductory and advanced global health. He has more than 40 years of experience in development and global health work. He spent 25 years at the World Bank, retiring as the Director for Health and Education for the South Asia region. And after leaving the World Bank, Richard was Vice President for International Programs at the Population Reference Bureau. He was also the Director of the Center for Global Health at George Washington University, where he taught undergraduate global health courses for 9 years. Richard also served as the Executive Director of the Harvard PEPFAR program for AIDS treatment in Botswana, Nigeria, and Tanzania. And in addition, Richard has served on a number of international technical and advisory bodies. And of course, he's the author of Global Health 101 from Jones & Bartlett, which is now in its 3rd edition, and it continues to be the best-selling global health textbook for undergrads. So with that, I will now hand the reins over to Richard Skolnik.
Thank you very much. It's very kind of you to offer such a kind introduction. And thank you very much to all of you who are joining today. I know what a busy time it is for you, and I'm very honored that you would come, and look forward to your exchanging views in hopes that all of us can do an ever-increasingly good job of teaching global health and doing better than we're doing now as well, and teaching intersectoral approaches to better health. Past that one. There are really 2 objectives for the webinar. The first is to quickly go over the importance of intersectoral approaches to addressing key global health issues. And the second, I hope, will be to create a platform for exchanging ideas about how we in the classroom can better enable our students to understand and propose actions on intersectoral approaches. Let me begin, if I may, at the end by suggesting what I think some of the main messages are. One is I want to suggest, as all of you know very well, that many, if not most, health issues faced, especially by poorer people in low and middle income countries will require intersectoral action to address in cost-effective, doable, sustainable, and fair ways. And that means action not only by the Ministry of Health, but also by the Ministry of Health in collaboration with other ministries. Two, is there are a number of ways that countries can approach this. One way might be through what we call health in all policies. Another would be to systematically carry out health impact assessments. And a third, recently recommended by the Disease Control Priorities Project, third edition, is that to suggest that every country, including low-income countries, should move quickly to adopt a package of intersectoral actions to address a range of their most critical health problems. We can think about intersectoral actions in a number of ways, but one way might be to think about the approach. Could it be through work with the Ministry of Finance, through regulation, through acting on the built environment, or through acting on education and information? And if you look at the DCP3 paper that was just published in The Lancet, or volume 9 of DCP3, you'll also see that they also talk about platforms, and that is at the community health worker level, at the level of primary health care, regional hospitals, or the tertiary hospitals. When we think about teaching, I'm sure all of you, as I have thought a lot about, well, what's the best way to teach this? You know, is it in part through all that we're teaching? Is it to take a separate block of time and be sure one helps students understand the concept of this? How do we deal with the pathways, moving from what it is that people get sick, disabled, and die from, why that happens, to what can be done about it, and the extent to which intersectoral action is necessary? I certainly don't have the answer, and I want now, and I'll do the same later, to invite everyone to share ideas about this. If you're comfortable, please feel free to share with me, you'll all have my email, how you might approach this and what you've learned from doing so, and I'll be happy in a month or so to blog about it, and therefore everyone who teaches global health who looks at the blog can, if they wish, learn from what you have learned yourself. Let me move. I want to begin, actually, if I might, by asking you a question and asking you to answer it online, and then Sophie can tell us how the answers come out. And that is, do you devote a specific block of time to teaching the concept of intersectoral approaches? If you would be so kind as to select yes or no, that'll be very helpful. And I'll be quiet for 1 second.
And I'm seeing responses coming in, changing, but it looks like roughly 40%, 35 to 40% saying yes. Many more people saying no, between 67 and 70% saying no. Okay,
that's great, Sophie. Can you take the quick poll off, Sophie, so I can see my screen a little bit better, or not? There we go, thank you.
Yes.
I want to suggest that as we talk about, think about, and teach intersectoral approaches, or the concept of why intersectoral approaches are so central, which everybody knows, everybody talks about water, sanitation, and hygiene, etc. But I want to suggest that it's going to be important for us to help our students follow a kind of pathway. And that, as I mentioned a second ago, is moving from what it is that people get sick, disabled, and die from, to why this happens, to what can be done about it, and what is the extent to which intersectoral approaches are necessary. I also want to suggest that one of the challenges of our teaching this is going to be, where do we put it? And we'll talk about that in a minute. Where does it fit in? We try to ensure that in all of our teaching, we raise the importance of the need for intersectoral approaches. Do we highlight that with a specific block of time? And in addition, if we've just covered some weeks ago the determinants of health, how do we try to help them understand the pathways toward intersectoral action without repeating and repeating and repeating again just what we had just covered on determinants of health? I think these are going to be interesting challenges as we try to enhance our teaching about this, especially in light of some of the new and improved information coming out, largely published by DCP3. But let's walk through this for a second. So here what you see is a slide that talks about what it is that people get sick, disabled, and die from. The top 10 causes of DALYs in 2015 in low, lower middle, upper middle, and high income countries, as taken from the Global Burden of Disease studies done by the Institute of Health Metrics and Evaluation. And then in the next slide, we see the top 10 risk factors for these DALYs that we've just seen, again, organized by the income group of the country. In the next slide, of course, now that we've covered with our students and reminded ourselves of what it is that people get sick, disabled, and die from, and the most immediate risk factors for that, we of course want to remind ourselves and our students that there are lots of risk factors that aren't so direct. There are structural determinants of health. There are social determinants of health, and it's going to be important as we and our students and policymakers think about what people get sick, disabled, and die from and why it is that they think very broadly, moving from the most immediate risk factors to those that are, of course, less direct, but often as important or more important. I also want to suggest, and this is very much following the lines of the new DCP3 paper in The Lancet, that while intersectoral approaches will be important to addressing a range of risk factors, they're going to be especially important in addressing the risk factors for social, environmental, and they're going to be, pardon me, especially important for dealing with the top environmental and behavioral risk factors. And in this slide, based on the new DCP3 paper, you'll see on the left the three classical, so-called classical groups of diseases, group 1, group 2, and group 3. Then you'll see the importance of the extent to which deaths in those groups are attributable to behavioral or environmental risk factors. And this is important because, of course, those behavioral and environmental risk factors are going to require more attention to intersectoral approaches than some other risk factors might do. As we talk about, we think about, and we help our students think about risk factors, there are a range of ways and a number of ways in which people can categorize them. One might be to think about intrinsic risk factors, another as diseases as risk factors for other diseases, and a third, behavioral and environmental risk factors. And when we move to the next slide, we try to relate this to the extent to which intersectoral approaches are necessary. And I want to remind you, as I'm sure you're already thinking, how imperfect the categorization is, and how imperfect my comments will also be about the link between certain kinds of risk factors and the need for intersectoral approaches. But very broadly and crudely speaking, if you will permit me, by and large, we won't expect intersectoral approaches to be so important for dealing with conditions with which you're born. Generally, people don't think intersectoral approaches are so important when we think about diseases as risk factors for other diseases. On the other hand, when you start thinking about those diseases which are risk factor for other diseases, I think you're going to find, as I did when I wrote this chapter, that intersectoral approaches may be more important than one might generally think. And that is, for example, when we're thinking about ways in which cervical cancer can be reduced beyond the vaccine for HPV, we can see immediately that reducing the risk that a young woman might face of getting infected with HPV has a lot to do not only with messages from the health sector, but also to do with issues that can enhance the girl's education, enhance her economic opportunities, and enhance her empowerment and her ability to negotiate fewer partners and safer sex. The last category, I think we would all agree, and we've just seen as well, that when we talk about social and behavioral risk factors, we should probably generally expect that intersectoral approaches will be really important. So we talked a bit about the pathways of how we move from thinking about and helping our students think about what people get sick, disabled, and die from, why this happens, and what can be done about it, and the extent to which we need to go beyond the Ministry of Health And I know I've repeated that, but I'm repeating it again because it's so central to our thinking about this. And then what are some of the ways in which governments more broadly might then approach intersectoral actions? One might be through what they call health in all policies. And probably the best example of this is Norway, but the Cubans do a lot of this, the Brits do a lot of this, as do a couple of other countries. And this is the notion that every ministry is accountable and responsible for contributing to the health and well-being of the entire population, and those ministries are expected to work together as they do so. Now, it may not be possible for health in all approaches to be taken in Liberia, in Mali, in Sierra Leone, in countries that are relatively weak administratively. But even in those countries, it's been strongly suggested that they can probably take a health in all policy approach to selective issues. And tobacco, of course, really sticks out as maybe the best one. And that is one where the Ministry of Health, which is Ministry of Finance, which is generally quite powerful in such countries, works with the Ministry of Health, probably with the Ministry of Agriculture, and together they try to take a comprehensive approach to reducing the uptake and the continued use of tobacco. And the WHO and the Public Health Agency of Canada in 2008 published a very good book of case studies of health in all policies that I recommend to you. It's cited at the bottom of the slide. And among the many cases that stick out, there are three that I cited in the bonus chapter. One, Uganda, where intersectoral committees were set up to try to deal with the health of people displaced during conflicts in the north. Second, India, where there has been a lot of writing about the famous Sonagachi HIV project, where cross-intersectoral programs were put together to try to help women enhance the overall quality of their life, put them at less risk of sex work, and try to keep them healthier. And Ecuador, where intersectoral health councils were formed in efforts to try to address maternal mortality, child mortality, and illiteracy. And there are many more such examples, and I do want to suggest to you that examples will probably be really important, and many cases will probably be important to helping our students think about this. Of course, we're all familiar with health impact assessments. I saw a study recently that suggested they're not done very frequently and not done as often as they might be helpful. I have a fair amount of experience working with both health impact assessments and social assessments, and perhaps naively, I still believe that both can be very helpful. And there's a lot of evidence that suggests when they are done, that they can bring together stakeholders across a range of activities, bring a broad perspective that looks at social, economic, and other issues to the investment that's being proposed, that they can focus on specific groups and whose health is likely to be affected by the investment. And finally, if they're done well, they can provide useful advice on the kinds of policies, data-driven and evidence-based policies that might be taken to minimize the adverse effects and maximize the possible health gains from the proposed investment. I'd mentioned a minute ago that the new DCP3 Lancet paper and the new volume 9 of DCP3 has put together an intersector policy package that it recommends for early adoption, even in low-income countries. And you'll see that in the next two slides. You'll see the key health risk on the left, a set of potential policy instruments in the middle, and the key agencies to be involved in the right. And then the DCP3 paper and volume, which I recommend to you, they've also looked at the platforms from which these policy instruments can be implemented. And so now that we've gone again through both the pathways for thinking about what needs to be done and the extent to which agencies outside the Ministry of Health need to be involved, and we've looked at three broad possible approaches country can take, let me turn finally and end by talking about, well, how do we teach this? And let me just ask now just one last question, if I might, and I think, Sophie, you're going to post it as well, right? And that is, do you use informal or short cases, informal or formal, short or perhaps even longer cases to help teach the concept of intersectoral approaches? If you could be kind enough to say yes or no to that, Sophie will be kind enough to tell us how we poll on that. Please go ahead.
Great, and the responses are still coming in, but I'm seeing roughly 50-50. A little bit more on the no side. Now it's tending towards 46% yes, 54% no. And I'll go ahead and close out that poll so you can see your screen.
Great, Sophie. Thank you so much, and thank you to all of you for answering. So again, I can't encourage you enough to share ideas, hopefully with me and with each other, about how you think one can most effectively enable our students to understand the concept of intersectoral approaches and to think about the policy measures that can be taken to put it in place. But one way, for example, would be to talk about types of problems. Let's talk today, for example, about undernutrition. We understand that a lot of the problem of undernutrition in low and middle income countries may have to do with people not having enough money to buy a healthy market basket of food. It may have to do with a lack of knowledge of appropriate caring and feeding practices. But once we scratch the surface, we also certainly understand that a lot of this has to do, for example, with how much the government cares about its marginalized people and the programs available to them. Another has to do with, well, what's the extent to which programs for education and knowledge about caring behaviors are available to these people. A lot will have to do with agricultural prices and agricultural markets and trade regimes and taxes and the cost of food to people. So it doesn't take much to understand that when one thinks about undernutrition, and I'm going to focus largely on low and middle income countries, there are a range of measures the Ministry of Health can take to promote breastfeeding, to promote a healthier diet, to promote the hygienic introduction of complementary foods. But it doesn't take much to understand that in many environments, this will not be enough, and that intersectoral action is going to be required. And if we were thinking about many cases, we could certainly say to our students, let's talk about Sarah, who lives in Pakistan, in Baluchistan, and who is very underweight for her age and on a trajectory to being stunted and possibly being cognitively stunted as well. Let's understand, why is it that Sarah is undernourished? What are some of the close-in and more distant reasons for that? And then let's ask ourselves, and the class as a whole, what's the extent to which the Ministry of Health alone can deal with that? Or by contrast, what's the extent to which other agencies also need to be involved? How and from what platform? One could also start, of course, by looking at the platforms. We talk, beloved students, a lot about the role of the Ministry of Health, but let's look for a second at what is the role of the Ministry of Agriculture, for example, in helping to address a range of health problems that affect everyone, or that affect in particular our marginalized and poorer groups that live in the East. Let's talk about whether or not there's a role for the Ministry of Finance in health and what that might be, for example. And we could also talk, for example, about different kinds of policy instruments. If obesity has something to do with the spaces for, especially in large cities, for exercise and whether or not people perceive them to be safe, what's the extent to which we need to worry about the built environment and who's responsible for that? Everything has to do, we know, with the single best investment in development overall, and that's the education, especially of the girl child. What are the many roles that the education ministry might have to play if the leading health problems among our poor people are really to be addressed? And finally, let me end by suggesting, as I have before, as I've thought about this more and as I taught it, though not as well as I would want to, I've thought a lot about how we can use cases and examples to help our students move from through these pathways, from understanding the particular problems and the risk factors to understanding what can be done and how it is that intersectoral approaches are important, and even the kind of approach one may take to ensuring that the Ministry of Health, the action by the Ministry of Health is complemented by others. Again, I thank you all very, very much for joining today. It's an honor and a pleasure. I hope very much to have the opportunity to meet many of you personally. And I'm going to stop here and we'll go on and move to our question and answers. Sophie, please take it from here. Thank you.
Thank you, Richard, for your excellent presentation. And yes, at this point, we'll go ahead and move into question and answers. As a reminder, if you have a question, simply type it into the questions box on the lower right-hand side of your screen, and I will read the question aloud. While we give everyone a moment to type in their questions, I have one question that's come through that, Richard, I'll go ahead and ask. Where in a comprehensive intro course on global health would you teach about intersectoral approaches?
Sophie, thank you very much, and I thank the person who submitted that question. I think it's a really interesting and challenging one. As I participated in the editorial advisory board for DCP3 and wrote this bonus chapter, which owes much to that volume, I thought a lot about this and the extent to which I did it well or not so well before. And I think there's really a range of possibilities. One thing I would say is I think, as many of you, or probably everyone is doing, I think it's really fundamental throughout the course to highlight the importance of moving beyond the Ministry of Health. We all talk about this when we talk about water, sanitation, and hygiene. We probably all talk about it as well when we talk about injuries. But I think it's probably important, no matter what we're talking about, to highlight the roles of different agencies and actors and the different platforms from which different actors carry out their efforts. But I have to say, having been on this editorial advisory board, and I'm like the 500th author of the Lancet paper, amusingly as well, I have come to believe that it's probably going to be valuable to take a specific block of time out of the course, maybe when one talks about health systems, and say, let's take a little break here and try to think systematically and coherently about intersectoral approaches and think about the framework for thinking about them and different frameworks for acting on them. Because I think otherwise there's a risk that our students won't be able to think through the many different kinds of cases. They won't think through the different agencies involved, and they may not get a good grip on the possibility of using health in all approaches, health impact assessments, and a kind of policy package on health as well. So that's probably where I come out, but I'm sure many of you are engaging in much better practice than me, and I'd very much love to hear from you, and again, I'd be happy to share ideas across a broader group. Thank you, Sophie. I hope that's okay.
That's great. Thank you, Richard. And we do have some questions coming through. And again, I would, just as a reminder, if you'd like to ask a question, simply use the questions box to type it in. Here's a question. How different is the intersectoral approach to health to the, quote, understanding the social determinants of health and improving health, unquote, or a multifaceted approach to address health?
Thank you very much for this thoughtful question. I think probably not very different, but I think it's worth highlighting this notion of intersectoral approaches, which is probably closer to multifaceted approaches rather than determinants of health, because I think much of the discussion of the social determinants focuses on determinants and risk factors and thinking broadly about the way people live, the way they work, etc. But I found a lot of literature on that doesn't lend itself so well to thinking about kind of conceptual frameworks for what do you therefore do about it. And with great respect for Sir Michael Marmot and the people who work on social determinants, I think when we talk about social determinants, a lot of the writing actually leads one to the risk of saying everything's related to everything else and doesn't lead to the kind of practical solutions that you might find, for example, in the DCP3 policy package. So I think by contrast, it's probably more related to the notion of multifaceted approaches, which is more on the action side than on the side of determinants and risk factors. Not very different at all. And perhaps the only thing I've been saying to myself now is the importance of lending a more coherent framework to thinking about it than I didn't do in a lot of my earlier teaching. And thank you. I think it's a very helpful question. Please go ahead, Sophie.
Great, thank you. We've got a lot of questions coming in. Here's another one. I appreciate the emphasis on the intersectoral approaches. I wonder where you see, quote, community engagement having a significant impact on the sustainability of an approach or initiative.
So, like many of you, of course, I'm a gigantic believer in the importance of community engagement. And I think there's a real overlap between community engagement and intersectoral approaches. Whether it's working with water, sanitation, and hygiene, it's working with education and education groups trying to ensure that teachers come to school and that people worry about whether or not children really learn. So I think, as I mentioned, it's important to think about some of these problems from the point of view of what kind of problem, what's the platform on which it can most effectively, sustainably, and fairly be addressed, and which agencies need to be involved. But I do think, community engagement is first, second, and third as a central starting point for all of this, and that it's quite useful to think about intersectoral approaches in terms of the community as well. My slide did not do that, but you'll see that the DCP3 Volume 9 and DC3P paper does that much better. And in fact, in all of the DCs, I commend all of the summaries at least of the 9 volumes to you, because they've gone beyond what they did in DCP2 by very precisely articulating platforms of engagement. And certainly the community platform is first, second, and third. So thank you for that question as well.
Thank you, Richard. Here's another question. How is system thinking related to intersectoral approaches in global health?
I'm not sure I'm the best person to answer that, because I'm not at all an authority on what people are calling systems thinking. So, with your permission, what I will say is, I think when we think more systemically and more broadly about the things people get sick and die from and why this is so, and then we're asked with our students what can be done in doable, sustainable, cost-effective, and fair ways to address these problems, and who needs to act and at what level, I think we'll be better off than if we don't ask those questions kind of systemically and consistently. In my own teaching, and those of you who use my book know, I've always tried to begin, continue, and end by asking 5 what I thought were systemic questions. What's the problem? Who gets it? Why do they get it? Why should we care? And what can be done as rapidly as possible, as cost effectively as possible, in doable, sustainable, and fair ways to make the world a better place. So I apologize for not answering perhaps the exact question you wanted, but I do want to suggest from the moment our students walk in until the moment they walk out, that taking a more systemic approach to thinking about these problems, walking through those 5 questions and adding to it who should act and at what level, and how do they need to act in concert, will, I think, produce better learning among our students and better approaches to addressing critical problems than we would otherwise do.
Great, thank you, Richard. Another question, how might we introduce interprofessional students, for example, medical students, nursing, law, pharmacy, and social work, et cetera, to their possible roles and contributions to the intersectoral settings you are discussing, such, for example, advocates, experts, other. How do they work with decision makers?
Another excellent question for which I thank you. So, of course, in my heart of hearts, I would love to have classes that bring together students from a range of interest groups and backgrounds and schools, but that isn't always the case. I taught in Yale College. In my last teaching, I taught in Yale College, I taught in the public health school, and I taught in the business school. And there were really 3 quite different groups of students. There were nursing and medical students in my graduate class, but it would have been wonderful to have had a broader issue. I think given what we know about the risk factors and determinants of health, And given what we know about the types of action needed to address them and the platforms from which such action is needed, I think it's really incumbent on us to try to ensure that all of our students, whether they're in dentistry, they're in nursing, they're in public health, they're in medicine, or they're undergrads, understands from the beginning, as it looks like everybody tries to do, how, why it is that people get sick, and the extent to which efforts to address these risk factors and determinants absolutely must go beyond the health sector itself. I had the good fortune many years ago, 5-6 years ago, speaking in Monterrey, Mexico, to a group of Mexican medical students with friends from Partners in Health. And Dan Palazuelos is a good friend from Partners, gave a talk on tuberculosis and the social determinants. And Dan said to Mexico's most elite medical students, kids of just immense competence, here's Juan Jose, who lives in the highlands of Puebla State, and he has tuberculosis. What is the cause of his tuberculosis? And the students all screamed out Mycobacterium tuberculosis, and Dan lowered the answer, and of course the answer in Spanish was poverty. And clearly, if the world is to be a healthier and better place, everybody, whether they're medicine, nursing, dentistry, pharmacy, or undergrads, really has to have a much better sense than many do not get now of the broad risk factors and determinants and the range of actions needed across agencies to address them. I know this answer sounds trite, but those of you who are physicians, I'm not, my son and daughter-in-law and all my friends are, will understand the extent to which medical education, for example, might be better at this than before, but in many respects, there's still an enormous road to hoe to ensure that our healthcare providers really are looking at people as people and the backgrounds from which they come and trying to get a much better fix on why it is that they're really ill, disabled, or at risk of dying. Sophie, back to you. Thank you.
Thank you, Richard. Okay, next question. In a strife-riven area of the world, how much does displacement from lands and breakup of the family unit contribute to barriers to intersectoral approaches to health? Do organizations like the UN and Gates Foundation apply the intersectoral approach?
So thank you for this question as well. I'm not at all an authority on humanitarian conflict, though, I tried with the help of friends to write a good chapter on it in Global Health 101. And those who are interested, I just, in preparing for my 4th edition, I just followed 2 massive open online courses on this topic, one from Hopkins and one from Emory. They're different. The Emory one was put together largely by folks from CDC. And for any of you who are interested in complex humanitarian emergencies and their relationship with health, I would encourage you to take a look at them. They were very, very enlightening. And the Emory one has a very good reading list which can help you to teach as well. My simple answer would be, complex humanitarian emergencies and strife raise an enormous number of risk factors and put families at terrible risk of ill health for a wide range of reasons. They've lost their land, they've lost their animals, they've lost their livelihood, they're displaced, they're refugees, or they're internally displaced. They didn't carry much with them. Some of them suffer from acute illnesses. Some of them have non-communicable diseases for which they didn't bring their medicine. Many of the women will be pregnant. And the circumstances, and many of them will be living in quite squalid circumstances until hopefully they get better with the help of others that pose grave health risks as well. My impression is that the folks who concentrate on complex humanitarian emergencies are in fact doing a much better job than they did 20 years ago in trying to think systematically about measures that can be taken to address the health of those who are affected and to use data-driven and evidence-based practices as they do so. Those of you who know Ron Waldman will remember his writings of 20 years ago. And to be polite, what he and others suggested was that a huge share of the humanitarian efforts 20, 25 years ago were not data-driven, were not evidence-based, and were really people just flying by the seat of their pants. My strong impression, and again, I'm not at all an authority on this, is that the world is doing much, much better now collectively in individual countries as well, and getting a better sense of what's really going on in these emergencies, learning across emergencies, coordinating them better, following global guidelines like the Sphere Handbook for addressing them, and trying to ensure under the coordination of WHO on the health side, various agencies work together. I'm sure it's still quite imperfect. My neighbor just got back from volunteering in Rohingya refugee camps in Bangladesh, but my impression is that it's moving in directions where agencies with a range of interests and talents are doing better than before at trying to ensure that the basics get met in a kind of intersectoral way. And anyone who'd be happy to share more information on that, if they want to pass it on, I'll be happy to share it as well. Sophie, thank you. Please go ahead.
Okay. Thank you, Richard. Next question. It seems intersectoral concepts or principles could also be used in trying to explain the principles of what public health is to those students unfamiliar with the field of public health. Would you agree?
Oh, yeah. I mean, oh, yes. I'm trained initially in public policy and had the good fortune to work for about 40 years on development and global health, and was very fortunate in working with a range of extraordinarily talented public health people, many at the top of their world game, and they did what they could to try to turn me into an intelligent layperson with as deep as they could get me an understanding of some of these problems. And my own training is quite broad. I am the biggest believer in the world that you really can't work on public health or global health unless you're an intersectoralist at heart. I don't see how you can work on public health or global health effectively, whether it's analysis, policy work, research, or provision. If you're not an anthropologist at heart, you don't understand and can't look at the world from a very broad-based approach. And I think it remains incumbent on all of us to try to ensure that the training of people in public policy who work on health, in public health, and in the provision of health services is really broad-based and helps them to work through those 5 questions that I raised earlier. Without that, it seems to me, it's just not going to be possible to try to enable better health, especially among poorer people in the world, and to do so in ways that are fair and responsive. Again, I know this is a trite response, but I'm not sure I could provide a better one. Sophie, please go ahead.
Okay, great. Thanks, Richard. Here's a question. Which key agencies or sectors would you recommend to students when presenting or discussing health and all policies to reduce preventable maternal newborn deaths and disabilities?
So that's a good question, and of course a difficult one. So, I mean, one thing, of course, is there's an enormous role for the health ministry in this, because if we're thinking about low and middle income countries, as all of you know very well, prenatal care is good, but there's a certain share of women who are pregnant who will face maternal complications, and when those maternal complications occur, they need to be evacuated, and they need to be in a place where the 3 delays can be avoided: the delay of appropriate diagnosis, the delay of movement to a place where they can be treated, and a delay in being sure that they're treated appropriately. In the simplest possible way, if we work through the 3 delays, we can see that the Ministry of Health work is not going to be enough. First, a woman might die in childbirth, and I love all the 80-some countries I worked on, so please forgive me. I don't mean to single out any negatively, but there are a lot of countries, there are countries where women die in childbirth because people think it's kind of normal, or people think that a woman can't be evacuated to a hospital without a male to accompany her, and the male is working in the Gulf states and there's no male available. So there's certainly a place for agencies that can help to ensure that women are better educated, have more economic power and more social power, and can play a larger role in determining their own health and their own care. Two is there are places where the provision of roads is really lousy. And if one is trying to get a woman to a health facility where she can have a C-section and do it quickly, it certainly would help if there's a system for transporting her and on roads that are actually passable in all seasons. And in many cases, it could turn out, especially in far-flung Western Nepal, for example, or in places in Bhutan, that the Ministry of Civil Works plays a really important role in a place where there might be good community-based care. There might even be hospitals at the regional level where they can do a C-section, but you can't get the woman there unless she is on a stretcher being walked down the hillside, for example. And again, I love Bhutan and Nepal both, and please forgive me for these examples, but they have some pretty far-flung places, as you know. And then, of course, the Ministry of Education in many places, the Ministry of Medical Education, not the Ministry of Health, is responsible for the training of providers. And in many countries, there are enormous questions on the quality of care that has a lot to do with both with training of healthcare workers as well as supervision. And finally, as many of you know, I'm sure all of you know, there are a lot of countries, especially countries in Latin America, that have chosen to go to move a lot of their health program toward results-based financing or conditional cash transfers. And the Ministry of Finance, working with other ministries, could play an important role in helping to design incentives that might encourage women to be taken to appropriate facilities when they have a complication. I would remind you, of course, that this isn't necessarily enough. When the government of India put in a conditional cash transfer scheme for encouraging women to give birth in hospitals, women began to flock to hospitals in the north, and yet that was before much was done to improve the supply side. And initially, the impact on maternal mortality was almost negligible. But this also raises the point that the Ministry of Finance might be a useful actor in even helping the Ministry of Health and other agencies think about incentive systems, monetary and non-monetary, within their own agencies to try to ensure that the many steps needed to try to deal with a woman, for example, who has a complication of pregnancy can be addressed. I know I've spoken quickly and excitedly, but I think it doesn't take much to imagine, even for something that seems so clinical as addressing hemorrhage, how important it might be to ensure, especially in low and middle income settings, how other agencies are involved. And finally, I would say, you know, people have tolerated in many countries maternal deaths, and in Texas, by the way, with all due respect, in a way we would never tolerate for a lot of other problems. And I think from the presidency down, if the president were to say, and they have in a few countries, no maternal death is acceptable, and therefore there'll be a presidential commission of inquiry for every maternal death that takes place, my guess is that in settings like that, one could spur the kind of collaboration needed and put a much greater emphasis on the idea of reducing maternal deaths down to their possible biological minimum. Please go ahead, Sophie, and thank you again for that thoughtful question.
Great, thank you, Richard. And we have, looks like we've got two more questions. Before I go to those, there is just a quick follow-up from a prior question, which I'm thinking we could address in maybe a follow-up email, which is just to, this is the question about teaching intersectoral approaches to students, just general field of public health students. The questioner is asking if to repeat the 5 questions that you ask students. So I don't know if that's something, Richard, you could quickly repeat, and sure. Like I said, we can also include that in a follow-up email. Yeah,
no, I'm happy to do that, Sophie. And I don't want to suggest these are the only 5, but I do want to suggest that throughout my years of teaching in two settings in a variety of schools, I found it fundamental from the first day to provide these as a framework for how we were going to organize the rest of the course in a kind of conceptual framework for students moving from problems to action. The first question is, what's the nature and magnitude of the problem? The second is, who gets it? You know, is it the rich people, the poor people, women people, men people, marginalized people, people who live in the capital city? The third question is, why do they get it? What are the risk factors and determinants for this problem? The fourth is, why should we care? How are you going to convince the Minister of Finance that money needs to be put into this and that the government needs to act on it? And lastly, based on the best data and evidence, what have we learned can be done in doable, in cost-effective, doable, sustainable, and fair ways to address these problems. And as part of the latter one, I will probably add in the 4th edition, when we're talking about the last question, we need also talk about who should be the actors in addressing these problems. How do they need to collaborate? And from what platforms, the community level, primary healthcare level, and other platforms should they act? Those of you who are using my book have access to my syllabi and know how extensively I worked to try to teach my students to write policy briefs. And if you go to the syllabi and what I've written about policy briefs, and we have model policy briefs on the book's website, you'll also see those are the questions around which I mercilessly beat up my students to try to get them to write concise and precise policy briefs as a central focus of my teaching for all the years that I did. If there are any follow-up questions, I'll be very happy to put something, give Sophie some additional information, and I'm sure she'll be happy to post it for you. But thank you for that question as well.
Yes, no, absolutely. I'd be happy to, in a follow-up, we can certainly send out an email with more information, the questions written out. There are 2 more questions here, which looks perfect for timing. So let's see, the next one we have here is, would you recommend teaching intersectoral approaches along with, quote, syndemic theory?
You know, I recently discussed this with someone, but with the permission of the questioner, I want to think about this a little more. I actually discussed it with more than one person, but on this one I'm going to take a pass, but promise to post something that I hope will be a thoughtful response. It's a good question, but I don't think I can give it an appropriate response, but I promise by the weekend to give one. And if you have one, again, I hope you'll feel free to share it with others.
Great, thank you, Richard. All right, last question. What are your thoughts to prioritize cultural attitudes and perspectives for successful intersectoral approaches?
So, you know, as you can imagine from what I said a minute ago about the notion that, you know, I think everybody who works in health at any level needs to be at least partly an anthropologist at heart. You know, I think enabling our students to understand frameworks for thinking about culture and its relationship to health are really central and have to be right up front to any understanding of what people get sick, disabled, and die from, what it is, or why this happens, or what can be done about it. And I'm sure the same will be true when we're thinking about interventions that the Ministry of Health might make alone, or interventions that the Ministry of Health needs to make in conjunction with others. There's a case study I cite in the book about indigenous women giving birth in Peru, and they wanted to give births, they traditionally gave birth standing up, and they were mortified and deeply offended by the Ministry of Health's wanting them all to go to hospitals where they were going to lay prone and give birth, while often male doctors who didn't speak indigenous languages attended to them. You know, whether it's maternal and child well-being or it's really anything else, it's just exceptionally fundamental for, I think, all of our students and everyone who works in health, you know, to at least have an understanding of frameworks for thinking about cultural attitudes. And then it's also fundamental as we, you know, public health is as intersectoral by its nature as possible. So I think understanding cultural attitudes and linking them to the multifaceted dimension of health is going to be absolutely central to all of the work that all of us do and teach, and all of the efforts we make to enabling our students to get the best possible understanding of what's the problem, why is it a problem, what can be done about it, and who needs to act on it. If this is the last question, Sophie, with your permission, I want to very much thank everyone for joining. You know, I know how miserable a time it is when finals come up just before the holidays, and I'm very grateful. I want to remind you of the humility with which I approach all of this, the extent to which I've learned from so many of my friends who teach, and my hope that you'll feel free to share your own ideas, many of which, if not most of which, I'm sure are better than my own, and which would be very welcome by, I'm sure, everyone on the line. I noted, by the way, if I might end by saying, I think someone from Wright State was on, and besides my thrill and honor that all of you are on, it's touching that someone would be on from my hometown and the town from which I made my first ever trip away from home, and that was to the Philippines in 1966, and that what got me started on this path. And I'm pleased to see so many folks from Indiana on. I was recently speaking at an event for Timmy Global Health and at DePaul. So I thank everyone very much again. I very much look forward to learning from you. I hope you appreciated my efforts, however simple and sometimes tight, to enable a good discussion. And I'll give it back to Sophie now to end the session.
Thank you so much, Richard. That was a fantastic presentation. I really appreciate all the thoughtful questions that came through, and we're getting some great feedback here, so thank you to all. I just want to mention, if you don't have a copy of Richard's new chapter, which just published last week, you can go to go.jblearning.com/Skolnik to request a copy of that chapter. Just click the Instructors Review Copy button, or reach out to your account manager. Or to me. I'm happy to connect you with your account manager to get you a copy. And same thing, if you're not currently using Global Health 101 and you'd like to consider it for course use, you can request a review copy at go.jblearning.com/Skolnik3 for the 3rd edition. And I will just change the slide. We have here, Richard has kindly offered to answer or any further questions or hear your comments directly. If you'd like to email him at this email address, reston.richard@gmail.com. You can also email me if you have any questions about how to get a copy of the book or the chapter. You can do that. And also, I would just remind you that the chapter is now being bundled automatically with Global Health 101 3rd edition. So if you're going to be using that in the spring, your students will get that additional bonus chapter at no additional cost, over and above the cost of the book. That's a free chapter. And then finally, I would just invite you to join our new Faculty Lounge group on LinkedIn. It's the Public Health and Health Administration Faculty Lounge. Richard blogs fairly regularly, and all of those blogs are posted there. The recording will be posted there as well. So I invite you to go over to go.jblearning.com/PH-LinkedIn to join that group. Again, thank you very much, Richard, for your presentation today.
My pleasure. Thank you.
And thank you, everyone, again, for joining us today. And with that, I'm going to go ahead and close out the session. Thank you.